Your erectile dysfunction isn't just bad luck or aging, it's likely caused by 5 specific things you're doing every day without realizing the damage. Today, I'm revealing the hidden triggers that are silently destroying your sexual health, and more importantly, how to stop them immediately. These aren't the obvious causes doctors usually mention. These are the sneaky, everyday habits that millions of men over 50 do routinely while wondering why their sexual performance keeps declining. The pharmaceutical industry doesn't want you to know about these because fixing them naturally means you won't need their expensive medications. I have worked with thousands of men who struggled with erectile dysfunction, and in nearly every case, they were unknowingly sabotaging their sexual health through these 5 critical mistakes. The good news? Once you identify and eliminate these triggers, your body can begin healing and restoring function naturally. Let's dive into the 5 things you must stop doing immediately if you want to overcome erectile dysfunction and reclaim your sexual confidence. Tishanda. Stop 1. Consuming hidden testosterone killers. The biggest testosterone destroyer hiding in your kitchen isn't alcohol or junk food. It's something the food industry has convinced you is healthy. Soy products, including soy milk, tofu, soy protein powders, and processed foods containing soy lecithin, are systematically destroying your masculine hormones. Soy contains compounds called phytoestrogens that mimic estrogen in your body. When you consume soy regularly, these plant-based estrogens compete with testosterone for receptor sites, effectively feminizing your hormone profile. Studies show men consuming just 2 soy protein shakes daily experience significant testosterone reductions within 4 weeks. The problem goes beyond obvious soy products. Soy lecithin appears in thousands of processed foods as an emulsifier: bread, chocolate, salad dressings, protein bars, and even supplements. Food manufacturers use soy lecithin because it's cheap, but they're not required to warn you about hormonal effects. Check every food label religiously. If you see soy, soy lecithin, soy protein isolate, or any soy derivative, eliminate it immediately. Your testosterone levels can begin recovering within weeks of soy elimination, but it takes months to fully reverse the damage. Replace soy milk with almond, coconut, or oat milk. Swap tofu for lean meats, fish, or eggs. Instead of soy protein powder, choose whey, casein, or plant proteins from peas or hemp that don't contain phytoestrogens. Plastic containers are another hidden testosterone killer. When you heat food in plastic containers or drink from plastic bottles, especially in hot cars or direct sunlight, toxic chemicals like BPA and phthalates leach into your food and beverages. These chemicals are endocrine disruptors that interfere with testosterone production and mimic estrogen in your body. Men with highest BPA levels have significantly lower testosterone and higher rates of erectile dysfunction compared to men with minimal exposure. Stop microwaving food in plastic containers immediately. Use glass or ceramic dishes instead. Replace plastic water bottles with stainless steel or glass alternatives. Never leave plastic bottles in hot cars or direct sunlight. Store food in glass containers rather than plastic storage bags. When buying canned foods, look for BPA-free labels, though even BPA-free cans often contain other endocrine disruptors. Conventional produce contains pesticide residues that act as hormone disruptors. The Environmental Working Group publishes an annual Dirty Dozen list of fruits and vegetables with highest pesticide contamination. These foods should be purchased organic whenever possible. Non-organic strawberries, spinach, kale, nectarines, apples, grapes, peaches, cherries, pears, tomatoes, celery, and potatoes contain pesticide levels that can significantly impact hormone production. If budget constraints limit organic purchases, prioritize these 12 items. Personal care products represent another source of hormone-disrupting chemicals. Conventional shampoos, body washes, deodorants, and toothpastes contain parabens, sulfates, and synthetic fragrances that interfere with testosterone production. Switch to natural, organic personal care products free from parabens, sulfates, phthalates, and synthetic fragrances. Read ingredient labels carefully. If you can't pronounce an ingredient, research its potential hormonal effects. Your laundry detergent and fabric softener also matter. Conventional products contain synthetic fragrances and chemicals that remain on your clothing and bedding, providing constant skin contact with hormone disruptors. Choose fragrance-free, natural laundry products, or make your own using simple ingredients like washing soda, borax, and natural soap. Your skin absorbs chemicals from clothing throughout the day and night, making this switch particularly important. Stop 2. Sitting disease and blood flow restriction. Extended sitting is literally killing your erections by restricting blood flow to your penis and suppressing testosterone production. Modern men sit an average of 10 to 12 hours daily, commuting, working, eating, and relaxing, creating a perfect storm for erectile dysfunction. When you sit for extended periods, you compress blood vessels and nerves in your pelvic region, reducing circulation to your sexual organs. Additionally, sitting increases pressure on your prostate and can contribute to pelvic floor dysfunction, both major contributors to erectile problems. Prolonged sitting also dramatically reduces testosterone production. Studies show men who sit more than 8 hours daily have significantly lower testosterone levels compared to men who move regularly throughout the day. The enzyme aromatase, which converts testosterone to estrogen, becomes more active in sedentary men. Set movement alarms every 30 minutes throughout your workday. When the alarm sounds, stand up and move for at least 2 to 3 minutes. This simple habit can dramatically improve circulation and hormone production over time. Invest in a standing desk or adjustable desk converter that allows alternating between sitting and standing throughout the day. Start with 15 to 30 minutes of standing each hour and gradually increase duration as your body adapts. Take walking meetings when possible. Instead of sitting in conference rooms, suggest walking meetings for discussions that don't require computers or documents. You'll improve your health while potentially enhancing creativity and problem solving. Use stairs instead of elevators whenever practical. Park farther from building entrances. Get off public transportation one stop early and walk the remaining distance. These small changes accumulate into significant health improvements. Replace evening television time with light physical activity. Instead of collapsing on the couch after dinner, take 15 to 30-minute walks with your spouse or partner. This provides quality time together while supporting your sexual health. Consider a treadmill desk or under-desk bike pedaler if your work requires extended computer time. These devices allow gentle movement while maintaining productivity, significantly improving circulation compared to static sitting. Your sleeping position also affects circulation. Sleeping on your stomach can compress blood vessels and nerves, potentially contributing to erectile dysfunction. Sleep on your back or side with proper pillow support for optimal circulation. Tight clothing, especially around your waist and crotch, restricts blood flow and can increase scrotal temperature, affecting testosterone production. Wear loose-fitting underwear and pants that don't compress your pelvic region. Bike riding can be problematic if your seat puts pressure on your perineum, the area between your scrotum and anus. This pressure can compress nerves and blood vessels essential for erections. If cycling regularly, invest in an ergonomic seat designed to reduce perineal pressure. Hot tubs, saunas, and hot baths can temporarily reduce testosterone production by overheating your testicles. While occasional use isn't harmful, daily hot soaks can negatively impact hormone levels and sperm production. Chapter Stop 3. Prescription medication. Side effects. Many common medications prescribed to men over 50 cause erectile dysfunction as a side effect, yet doctors often fail to discuss this connection or explore alternatives. If you're taking multiple medications, One or more could be directly causing or contributing to your sexual problems. Blood pressure medications are among the worst culprits for erectile dysfunction. Diuretics, beta blockers, and ACE inhibitors all can reduce blood flow and interfere with the mechanisms necessary for healthy erections. Ironically, while these medications protect your heart, they may be destroying your sexual health. Diuretics like hydrochlorothiazide reduce blood volume and can decrease blood flow to your penis. Beta blockers such as metoprolol and atenolol block nerve signals involved in achieving erections. Some ACE inhibitors can also interfere with normal sexual function. If you're taking blood pressure medications and experiencing erectile dysfunction, discuss alternatives with your doctor. Some newer blood pressure medications, particularly angiotensin receptor blockers like losartan, have lower rates of sexual side effects. Antidepressants, especially SSRIs like sertraline, paroxetine, and fluoxetine, are notorious for causing sexual dysfunction. These medications affect neurotransmitters involved in sexual arousal and can make achieving erections significantly more difficult. The cruel irony is that erectile dysfunction often causes depression and relationship problems, leading to antidepressant prescriptions that worsen the sexual issues. This creates a vicious cycle where treating depression symptoms worsens the underlying problem. Work with your healthcare provider to explore antidepressant alternatives with lower sexual side effects. Bupropion actually enhances sexual function in some men and might be a better choice if you need antidepressant treatment. Antihistamines, both prescription and over-the-counter, can contribute to erectile dysfunction by reducing blood flow. Common culprits include diphenhydramine, Benadryl, loratadine, Claritin, and prescription allergy medications. Prostate medications like finasteride, Propecia, Proscar, prescribed for enlarged prostate or hair loss, can cause persistent erectile dysfunction even after discontinuing the medication. This condition, known as post-finasteride syndrome, can last months or years. Acid reflux medications, particularly proton pump inhibitors like omeprazole and lansoprazole, may contribute to erectile dysfunction by reducing nutrient absorption necessary for healthy sexual function. Pain medications, especially opioids, significantly suppress testosterone production and can cause both erectile dysfunction and reduced sexual desire. If you're taking pain medications long-term, discuss alternatives with your healthcare provider. Muscle relaxants and anti-anxiety medications often cause sexual side effects by depressing central nervous system function. Benzodiazepines like lorazepam and clonazepam are particularly problematic for sexual function. Never stop taking prescribed medications without medical supervision, but do have honest conversations with your healthcare providers about sexual side effects. Many doctors are willing to adjust medications or explore alternatives when patients express concerns about sexual function. Keep a medication and symptom diary tracking when you started each medication and when sexual problems began. This information helps healthcare providers identify potential connections and make appropriate adjustments. Welcome to Senior Health Tips. If you're discovering how everyday habits are causing your erectile dysfunction, please subscribe and hit the bell icon for more men's health content designed specifically for men over 50. I want to ask you, which of these hidden triggers surprised you the most? Are you currently taking medications that might be affecting your sexual health? Leave a comment below and let me know your biggest concern about these hidden ED causes. Your question might be featured in our next video. Stop 4. Chronic stress and sleep disruption. Chronic stress is silently destroying your sexual health through multiple pathways. Yet most men over 50 don't realize the profound connection between stress levels and erectile function. When you're constantly stressed, your body prioritizes survival over reproduction, systematically shutting down sexual function. Stress activates your hypothalamic pituitary adrenal axis, flooding your system with cortisol. This stress hormone directly suppresses testosterone production and interferes with the complex neurological processes necessary for healthy erections. Men with chronically elevated cortisol have significantly higher rates of erectile dysfunction. The modern lifestyle creates perfect conditions for chronic stress. Financial pressures, health concerns, relationship issues, work demands, and information overload keep your stress response system constantly activated. Your body interprets this as ongoing threat, making reproduction a low priority. Identify your primary stress triggers through honest self-assessment. Common sources include work pressure, financial concerns, relationship conflicts, health worries, and family responsibilities. You can't eliminate all stressors, but identifying them is the first step toward management. Implement daily stress reduction practices that activate your parasympathetic nervous system. Deep breathing exercises, meditation, progressive muscle relaxation, and yoga all help counteract stress hormones and support healthy sexual function. Set boundaries around work and personal time. Constantly checking emails or taking work calls during personal time keeps your stress response activated. Establish specific work hours and stick to them, allowing your nervous system time to recover. Reduce information overload by limiting news consumption and social media use. Constant exposure to negative news and social comparison increases cortisol levels and contributes to anxiety and depression. Set specific times for consuming media rather than constant exposure. Poor sleep quality compounds stress effects and directly impacts sexual function. Sleep deprivation increases cortisol production while suppressing testosterone synthesis. Most testosterone is produced during deep sleep phases, making quality sleep essential for sexual health. Sleep disruption creates a vicious cycle where stress causes poor sleep, which increases stress hormones, making sleep even more difficult. Breaking this cycle requires addressing both stress management and sleep hygiene simultaneously. Create a sleep environment optimized for deep, restorative sleep. Keep your bedroom cool, dark, and quiet. Remove electronic devices or use blue light filters. Invest in comfortable mattresses and pillows that support proper alignment. Establish consistent bedtime routines that signal your body to prepare for sleep. This might include reading, gentle stretching, meditation, or other relaxing activities. Start winding down 30 to 60 minutes before intended sleep time. Avoid caffeine after 2 p.m. as it has a 5 to 6 hour half-life and can interfere with deep sleep phases even if you fall asleep normally. Also limit alcohol consumption, especially close to bedtime, as it disrupts sleep architecture and reduces REM sleep. Address sleep disorders like sleep apnea that are common in men over 50 and strongly linked to erectile dysfunction. Sleep apnea causes repeated oxygen deprivation that damages blood vessels and reduces testosterone production. If you snore regularly, experience morning headaches, or feel tired despite adequate sleep time, discuss sleep evaluation with your healthcare provider. Treating sleep apnea often dramatically improves both sleep quality and sexual function. Exercise regularly, but time it appropriately. Physical activity reduces stress hormones and improves sleep quality, but vigorous exercise within 3 hours of bedtime can be stimulating and interfere with falling asleep. Practice stress inoculation by gradually exposing yourself to manageable stressors while practicing coping techniques. This builds resilience and reduces your overall stress response intensity. Consider professional support if stress feels overwhelming. Therapists, counselors, and stress management coaches can provide strategies tailored to your specific situation and help break destructive stress patterns. Bubber. Stop 5. Inflammatory foods and poor gut health. Chronic inflammation is a hidden driver of erectile dysfunction that most men completely overlook. When your body is constantly fighting inflammation, it diverts resources from sexual function and damages the blood vessels essential for healthy erections. Inflammatory foods create internal environment hostile to sexual health. These foods damage your endothelium, the inner lining of blood vessels that produces nitric oxide necessary for erections. Without healthy endothelial function, achieving and maintaining erections becomes increasingly difficult. Processed foods loaded with refined sugars, trans fats, and artificial additives are primary inflammation triggers. These foods spike insulin levels, create oxidative stress, and promote inflammatory cytokine production throughout your body. Eliminate refined sugars and high fructose corn syrup from your diet immediately. These sweeteners not only promote inflammation, but also contribute to insulin resistance and diabetes, major risk factors for erectile dysfunction. Read labels carefully as sugars hide in unexpected foods. Trans fats, found in margarine, commercial baked goods, fried foods, and many processed snacks, are particularly damaging to cardiovascular health and sexual function. These artificial fats increase inflammation, damage blood vessels, and should be completely eliminated. Excessive omega-6 fatty acids from vegetable oils create inflammatory imbalance in your body. Common cooking oils like soybean, corn, sunflower, and safflower oils are heavily processed and promote inflammation when consumed regularly. Replace inflammatory oils with anti-inflammatory alternatives like olive oil, avocado oil, and coconut oil. These healthy fats support cardiovascular health and may actually improve sexual function rather than hindering it. Your gut health directly impacts inflammation levels and sexual function through the gut-brain hormone axis. Poor gut health increases systemic inflammation and can interfere with hormone production and neurotransmitter synthesis. Processed foods, artificial sweeteners, and antibiotics damage your gut microbiome, the trillions of beneficial bacteria essential for optimal health. When harmful bacteria overgrow, they produce toxins that increase inflammation and interfere with nutrient absorption. Consume fermented foods like sauerkraut, kimchi, kefir, and yogurt that provide beneficial probiotics. These foods help restore healthy gut bacteria balance and reduce systemic inflammation. Include prebiotic foods that feed beneficial bacteria. Garlic, onions, asparagus, bananas, and Jerusalem artichokes contain fibers that promote healthy gut bacteria growth. Minimize antibiotic use when possible, as these medications destroy beneficial bacteria along with harmful ones. If antibiotics are necessary, follow treatment with probiotic supplementation to restore gut health. Food sensitivities and allergies create chronic inflammation that can impact sexual function. Common culprits include gluten, dairy, eggs, and nuts. If you suspect food sensitivities, consider elimination diets to identify triggers. Excess alcohol consumption damages gut lining and promotes inflammatory bacteria overgrowth. While moderate alcohol might not be harmful, excessive consumption directly impairs sexual function through multiple mechanisms. Advanced glycation end products, AGEs, formed when proteins and sugars react under heat, create significant inflammation. These compounds form during high-temperature cooking methods like grilling, frying, and roasting. Reduce AGE formation by using gentler cooking methods like steaming, poaching, and slow cooking. When grilling or roasting, marinate foods in acidic ingredients like lemon juice or vinegar to reduce AGE formation. Chronic dehydration contributes to inflammation and reduces blood volume necessary for healthy erections. Many men over 50 are chronically dehydrated without realizing it, as thirst sensation decreases with age. Drink adequate water throughout the day. Aim for half your body weight in ounces. Monitor urine color as hydration indicator. Pale yellow indicates proper hydration, while dark yellow suggests dehydration. Environmental toxins from air pollution, household chemicals, and personal care products contribute to chronic inflammation. While you can't eliminate all exposures, Reducing toxic load helps decrease inflammatory burden. These 5 critical areas, hidden testosterone killers, sitting disease, medication side effects, chronic stress and sleep disruption, and inflammatory foods, represent the primary hidden causes of erectile dysfunction in men over 50. The encouraging news is that once you identify and address these triggers, your body has remarkable ability to heal and restore function. Many men notice improvements within weeks of eliminating these harmful factors, with continued progress over months as their bodies recover. Don't try to address everything simultaneously. Choose 1 or 2 areas where you can make immediate changes and gradually expand your improvements over time. Small, consistent changes create lasting transformation. Remember that erectile dysfunction often signals underlying health issues that extend beyond sexual function. Addressing these root causes doesn't just improve your sexual health, it enhances your overall well-being, energy levels, and quality of life. Your sexual health is worth protecting and restoring. By eliminating these 5 hidden triggers, you're taking control of your health and giving your body the best chance to heal naturally.